And so essentially they've now been confronted with the reality, which is that these restrictions which were lifted are now going to have to be put back in place.
Absolutely. You know, not that long ago, it seemed here in Asia that the pandemic was on the wane, but we are seeing a spike of infections in many parts of the region, especially in South Korea. In South Korea earlier today, we heard from health authorities. They have reported a record high number of new infections, as well as critical cases, especially among members of the elderly population, a very vulnerable group. Now, the government has responded by ramping up its booster jab campaign starting last Saturday. The interval dosage time between initial vaccinations and the booster shot has been cut from 4 to 5 months to 3 months. And not only that, we're also learning that the South Korean government is planning to roll out a pilot program involving artificial intelligence, facial recognition systems, and thousands of CCTV cameras to find, detect, and track people who are infected with COVID-19. Now, meanwhile, in Australia, New South Wales, this is the most populous state in Australia, as well as home to Sydney, it has reported its highest number of new cases in 3 months. And as COVID-19 cases rise in New South Wales, restrictions are being relaxed. In fact, QR codes are no longer required in certain businesses like supermarkets and shopping centers. We also learned that masks are only required in the airport or public transport, on airplanes, or among staff members who are unvaccinated and work in indoor hospitality. And on top of that, starting today, Australia is granting all fully vaccinated travelers from Japan and South Korea to enter the country without the need for quarantine. This, again, as South Korea has reported a record high number of critical cases and new cases of COVID-19. John.
Okay, so now we have the Omicron variant, which is also causing a lot of concern, and it's spreading across China. So what do we know about that?
Yeah, well, we talked about this a little bit yesterday. There's an update. Hong Kong has reported now 8 cases of the Omicron variant, all detected at the border. The first case detected in mainland China was found in Tianjin at the border. A second case was later detected in the day in Guangzhou. And this involves a 67-year-old man who had touched down in Shanghai November the 27th, was there in hotel quarantine for 2 weeks, tested multiple times for COVID-19, and then flew from Shanghai to Guangzhou, and that was where he tested positive for the Omicron variant. So it begs the question, where did he pick up the variant? Did he pick it up while overseas, or did he become infected with it inside China? I want you to listen to this.
The chance that he got the virus in the quarantine hotel is pretty high. The quarantine hotel still have some facility to prevent the spreading. Most COVID cases, actually 85% of them, do not spread to more than 5 people. So the risk is not very high.
Now, authorities in Henan province in China have isolated and they have reported 1 close contact of that Guangzhou Omicron variant case. This was an individual who not only was on the same flight from Canada to Shanghai with the Omicron case, but also shared the same quarantine hotel. But still, a lot more details are needed to figure out just what's happening here and just how far the variant has spread in China. Back to you.